mRNA technology is not new. It's been used in chemotherapeutics for many years, and scientists have been studying the coronavirus family for many, many decades. So as a parent, as a pediatrician, I have no concern about the long-term effects of these vaccines other than protecting our children.
Dr. Matthew Harris runs the pediatric vaccination program with Northwell Health and says there's no reason to believe this vaccine will cause long-standing issues in children other than protection against COVID-19. Early data shows Pfizer's COVID vaccine given to young children at 1/10 the strength of an adult dose produces immunity. For children 6 months to 2 years, 2 doses prove to be effective, but a third booster shot may be needed for kids 2 and older.
What we're waiting to see is a long-term efficacy. Hopefully this becomes a vaccine that you get once a year prior to respiratory season so we can avoid this cycle of frequent boosters. Though the way we do this is by vaccinating as many people as we can and reducing the likelihood of variants that are resistant to the vaccine.
Some parents aren't decided. I just want to know, as a parent, would you vaccinate your younger daughter?
I wouldn't.
You would not?
I don't know yet.
The Children's Health Defense filed this lawsuit against the FDA over its emergency use authorization of COVID vaccine for 5 to 11-year-olds and is calling a jab for infants and toddlers unethical.
We believe there is not sufficient science to justify the authorization for children 5 to 11. Going now for infants from 6 months to 4 years old is unethical and dangerous. There's not really a safe vaccine unless it's been tested for approximately 5 years. This has been tested for under 2 years.
Dr. Harris understands the skepticism when it comes to young children, but is encouraging parents to talk to their pediatrician. He believes COVID is never going away, but when the pandemic turns to an endemic and enough people in the community have protection through vaccination or infection, vaccines will be once a year, similar to the flu shot during respiratory season from November to March in the Northeast.
If you drop a match in the forest, that the whole forest doesn't go up in flames, that you might lose a tree or two. And that's why we see these spikes in COVID the same way we see a bad flu season. That is the most likely outcome after the pandemic.
That's how he describes what the endemic will be looking like. And we talked to Northwell about their rollout of the vaccination for this age group. They say the difference will be it'll be pushed out through pediatricians' offices so that parents can have that one-on-one conversation and have confidence in whatever decision they make.